Hello. I wanted to firstly thank you for being interested and willing to participate in this pilot of a holistic review. Just want to tell you a little bit about the outcome that we want, and that is that we want to identify students as a senior clinician, a high-performing student, a junior clinician, someone who's doing well enough and performing safely, and then remediate, which is someone that's perhaps falling behind and at risk of not progressing to the next level. So, next thing I want to tell you is you might be coming here thinking, well, I honestly I feel this way. I don't remember the students that well because I only work with them a handful of times. And that's perhaps not a lot of experience to be able to speak about students. Sometimes it's okay, especially if there are red flags. But I guess I want to tell you that a model that we want to try to move to, with your partnership, of course, is that having faculty maybe over a term working regularly with the same group. That way, instead of having 5 or 6 interactions a term, which is my experience, so now you might be having 12 or 13 or more experiences with a student, and then your viewpoint of that student is pretty clear cut. You've had a lot of experience with them. So the holistic review, I think this is just a pilot, but I think it would work even better in that environment. And of course, we take your feedback in designing that and moving forward. Why have a holistic review? Well, actually, this is not my opinion, although I share this opinion, but this is what you, the faculty, said when we did a pilot in December with a very small group of faculty and a small group of students that were reviewed. This is what you said. Number one, it's helpful to be able to intercede with students who are struggling early. And sometimes students are getting through to D4 and perhaps they're not as competent as we may expect for a D4, but they have simply fulfilled all their requirements. They've strategically completed their test cases and achieved their CEUs, but they may be someone who is not able to put it all together, which is actually point number 2. And point number 3 is traditional assessments allow some to pass despite not being ready for practice. So they may not be an independent thinker, but they're able to do a DO amalgam or a crown prep or whatever, but in terms of thinking through what a patient needs, considering their risk, and building a treatment plan based on that, and then diagnosing dental disease and delivering treatment, all that together is just not working. But in isolation, they're able to prep and do the work that they have to do. So another thing that you, the faculty, said is that we need multi-source assessments. And right now, we're somewhat focused on clinical skill, but dentistry, as you all who practice dentistry know, it's not that much about clinical skill. Honestly, that is kind of the easiest thing that we do. Bringing patients in who are, who have complex medical histories, who are stressed and anxious about receiving care at the dentist, and then making them feel safe and comfortable and providing the anesthetic and then delivering the care. That's the great challenge in dentistry. And it's not just the clinical skill of doing, direct and indirect restorations and prosthesis and things like that. Last thing is, the last point that you, the faculty, said is CEUs and test cases alone are not good measure of a dentist. However, those things are needed too. So thank you very much for your willingness to participate. I'm not always here in my office, but if you have feedback or suggestions, feel free to catch me in the clinics if you see me, or email me, or slip a note under my door, anything that works. We just want to build something that's really great, and it doesn't have to be this idea. We can change it as much as seems appropriate. We just want something good for this school that lives up to the reputation of this school and helps us to produce great clinicians and not just average ones.